There has been very positive feedback from practitioners. We've had feedback in regards to the feedback that they've actually been getting from their clients, and how it's assisted them to actually be, followed through, and but also it actually, from a practitioner's perspective, they've really seen improvement in their clients as well, and so for them it's actually getting through.
Often it's the caregiver who, if it's an adult looking after a child or a caregiver for somebody with a disability, they're not medical people, and yet the responsibility is placed quite squarely on their shoulders to ensure compliance with the advice that the health professional is giving the client. And so I definitely see that digital health solutions have massive role to play in assisting that process, so that we can get that compliance rate up and we can get better clinical outcomes. My name is Darron Goralsky. I am a physiotherapist by training. I've been a physiotherapist for over 30 years, and I am the clinical director and founder of Melbourne TMJ and Facial Pain Centre, which is a clinic dedicated to the treatment of jaw pain, face pain and headaches. In my time in allied health, I've definitely seen an increase in musculoskeletal type injuries or presentations in kids and younger adults, and I would say that's definitely attributed to the increased amount of time that they are spending in front of screens, mobile phones, etc., sometimes at the expense of leisure time physical activities. So it is something that we've noticed has definitely increased over the period. Also with COVID, where people were not able to participate in group exercise, were spending longer in front of screens, sometimes in less than ideal postures from a work from home scenario, we also saw a massive increase in particularly the types of conditions we see where there's a big stress component. So people who are suffering from jaw pain, face pain as a consequence of those postures, and clenching, grinding, which is often associated with those conditions. We have a multidisciplinary model of care. The types of conditions that we treat, we know, involve many different aspects of human function. And so to adequately address them, we have a team that is made up of physiotherapists and osteopaths that we call TMJ therapists. We also have dentists that specialize in the treatment of jaw pain, but also sleep apnea. We have a GP on our team who provides Botox for recalcitrant cases, and we have a functional breathing expert. So in our model of care, we place a lot of emphasis on the patient to make specific lifestyle changes. It might be around postures or breathing habits or sleeping, quality of sleep or posture of sleep. And so there's a lot of responsibility on them to do things in between sessions. And for that reason, we find adherence to all our advice quite a challenge. I would say that on average, we probably have about 60 to 70% adherence rate. And even then, there's more that people could be doing to have better awareness of things they may be doing during the day that's negatively influencing their outcomes. Those 30 to 40% that are not compliant is quite significant both for them in terms of their outcomes. It means that their symptoms may not go away as readily, and they may feel that they're not making the progress that they would hope. But it also has a negative impact on the mindset of the therapist, who can feel like they're not getting the outcome that they desire for that patient. It can be quite disheartening for therapists as well as for patients.
My name is Christopher Peck. I'm the Chief Operating Officer of Tasky. Our company has an app called Tasky, and this is deals with many areas, primarily at the allied health space. So we're catering for occupational therapists, speech therapists, physical therapists, But it's more diverse than that because we also cater for life coaches, music teachers. There's a whole broad interest in this app to actually provide that home support after a particular lesson or engagement with a health professional. We have a son with special needs. He was born with Down syndrome. We have spent a lot of money in going to allied health professionals to help James in both occupational therapists, speech therapists, to name two. But what we found is that in between sessions, and when he revisited the professional again, it was just like starting off back at the first base again. So we saw that there was a gap to try and utilising. We developed Tasky with the whole purpose of actually bridging that gap between sessions and providing him with the tools through the app to be able to maintain that continuity. From a practitioner perspective, there's also that I suppose disappointment in regards to every time the patient actually comes back, they're starting back at stage one again, and there is no continuity, and also it probably raises a bit of professional doubt on their behalf of are they actually getting through. And this is where Tasky itself actually addresses that gap. It actually provides them with the tools in regards to the visual of what they've actually done in that session. Instruction, audio, PDFs, the regular notifications to be able to do these particular activities that they actually learnt in the session. But it also builds up the intellectual property of the professional as well, and to share that with their customer base, to be with them in a home activity is quite a valuable asset for them, and it actually shows from the client that they have that the professional cares and is wanting to follow through and build, give them some success from the session that they had.
We've embraced technology as much as we can over the last few years to assist not only our workflows internally with our patients, but also our way of communicating with patients and enabling them to access their home exercises and the things that we want them to do in between sessions. The adoption rate has taken time, particularly whenever we introduce a new piece of software. To get the team to remember to use it has been a challenge, but we're all very aware now of the benefits that this brings to us as clinicians and to the patients, that it helps empower those patients to do the things that we want them to do.
There has been very positive feedback from practitioners. We've had feedback in regards to the feedback that they've actually been getting from their clients, and how it's assisted them to actually be, followed through, and but also it actually, from a practitioner's perspective, they've really seen improvement in their clients as well, and so for them it's actually getting through.
I think digital health is definitely here to stay, not as a replacement for the sessions that we provide in clinic, but to help supplement the things that people need to do, whether it be the patient themselves or the caregiver. Often it's the caregiver who, if it's an adult looking after a child or a caregiver for somebody with a disability, they're not medical people, and yet the responsibility is placed quite squarely on their shoulders to ensure compliance with the advice that the health professional is giving the client. And so I definitely see that digital health solutions have massive role to play in assisting that process so that we can get that compliance rate up and we can get better clinical outcomes.
We've seen a real difference in James as a result of actually utilising the app, but we're also using it in a new area as well, which is he does swimming on a weekly basis, and we actually film him doing swimming, and that helps him to actually have that visualization, that connection through video self-modeling of him seeing, doing the swimming. So that builds up the confidence and the neurological, pathway to actually say, I can do this. He sees himself, and that actually fills him, we think, with pride and knowing that he can actually do it.